Hi, good afternoon. My name is Emanuel Cruz Carrasco. I'm going to read the chapter 1 of Professional English Use in Medicine. Health and illness. A. Asking about health. Health is the state of the body. When doctors want to know about a patient's usual health, they ask questions such as, what is your general health like? How's your health generally? If you are in good health, you are well and have no illness, disease. If you are healthy, you are normally well and can resist illness. If you are fit, you are well and strong. This is a little map, a mental map that shows the connections between the health and illness states. Not ill, healthy, fit, fit and well, well, very well, in good health. Ill, unhealthy, unfit, unwell, not well, not very well, poorly, in poor health. B. Sickness. Sickness has a similar meaning to illness. It is also used in names of a few specific diseases. For example, sleeping sickness and travel sickness. Patients also talk about sickness when they mean nausea and vomiting. Nausea and vomiting, sorry. Patient says, I was sick this morning. Possible meanings. I was ill this morning. I felt unwell this morning. I vomited this morning. I feel sick. Possible meanings. I feel ill. I feel unwell. I am nauseous. I feel the need to vomit. The combination sickness and diarrhea means vomiting and diarrhea. C. Recovery. When patients return to normal health after illness, they have recovered. We can also say the patient made a good, full, complete recovery. If a patient's health is in the process of returning to normal, the patient is improving. The opposite is deteriorating. We can also say that the patient's condition improved or deteriorated. In speech, we often use the verb get to talk about change. Get over an illness, get better, get worse. Get over an illness is to recover. Get better is to improve. Get worse is to deteriorate. If a patient is better, who then gets worse again, the patient has relapsed. Another word for improvement, especially in recurrent conditions such as cancer, is remission. He got over the illness very quickly. 2 years later, she remains in complete remission. Because I've been said by my coordinator that I have been granted an exception from the work of translating the chapter 1 of professional English use in medicine. Now I'm going to directly Read the exercises. This is the exercise sheet. As you see, I did it with pencil. Exercise 1.1. Complete the table with words from A and B opposite. The first one has been done for you. Noun. Fitness. Adjective. Fit. Noun. Health. Adjective. Healthy. Noun. Illness. Adjective. Ill. Noun. Sickness. Adjective. Sick. Exercise 1.2. Make word combinations using a word from each box. Look at A, look at B and C opposite to help you. The words that can be used for the combination are complete, fill, get, or trouble. Sickness, health, remission, sick, over. These are the word combinations that I realized. Complete remission, trouble, sickness, poor health, get over, feel sick. Exercise 1.3. Complete the conversation. Look at B opposite to help you. Doctor, how are you feeling today? Patient, not very well. Doctor, how long have you been feeling unwell? Patient, about a week. Doctor, why is your health like normal? Patient, very good and usually quite fit and well. Doctor, what is the problem now? Patient, it's my stomach. Doctor, do you feel sick? Patient, yes. Doctor, have you actually been nauseous? Patient, no. Doctor, have you had any serious illness in the past? Patient, no, none at all. Exercise 1.4. Choose the correct word to complete each sentence. Look at B and C opposite to help you. 1. Her condition deteriorated. Sorry, I'm going to start again. 1. Her condition. The options are deteriorated, improved. Her condition deteriorated and she died. 2. He. The options are relapse, recover. He recovered and was allowed to go home from hospital. 3. The cause of sleeping. The options are illness, sickness. The cause of sleeping sickness was discovered in 1901. 4. The patient made a full. The options are remission, recovery. The patient made a full recovery. 5. I have been in. The options are poor and good. I have been in good health for months and feel very fit. 6. It was a month before I. The options are got over, got better. It was a month before I got over the illness. 7. He seems to be rather. The options are unhealthy, unwell. He seems to be rather unhealthy. His diet is bad and he never exercises. This is my worksheet. As you see, I did it with a pencil. So here is my work. Thank you very much for your attention. So that's it. Thank you very much. This was Chapter 1, Theory and Exercises of Professional English Use in medicine. Because I want to reiterate, I was informed by my coordinator that I was one of the students granted I section. I was allowed to only read the theory in English. Because of that exception, I want to thank the coordinator for her trust in my capabilities and the professor for granting me this boon. So thank you very much for watching this video.